I got to thinking recently, why is it that the industry is moving on with self replicating mRNA vaccines when we barely understand what happens with mRNA vaccines? So it turns out that they are interested in reducing the dose. But I said, well, it's the same mRNA that's delivering, but the self replicating ones will produce more mRNA, which produces more protein. So why would you want to change what's already working unless there is a problem? And the problem seems to be that they're trying to reduce the dose of lipid nanoparticles. Do you even know anything about it? Does the medical community understand it? Does the pharmaceutical industry actually have a full grasp of the implications? The more I look, the more worried I get. So I'm going to give you some of the science around what's going on. And critically, I'm going to be playing a video clip from a Congress that we did last year with Christy Grace, and she was detailing her concerns about lipid nanoparticles. I don't think it got enough attention, so I am playing it again. It's very complex. She is very quick, so I may interrupt sections of it just to make the point that so that you understand it. So we'll be going through this. It's a complex topic. I can't claim to be an expert, but I'll show you what it is that I have understood based on the science that's put in front of us. So let's take this journey. Before we start, just reminding you, if you haven't done so already, join us for our Health and Wellness Network meeting, session 3, coming up just in a few days' time. Register on the link below. And additionally, we have our Prepared Against Disease X. This has been successfully launched on Kickstarter. And for those people who want to help us get it to number one when it goes on Amazon, please join us here. You will get the book and you'll be able to support this important piece of research. So let's get back to the question about lipid nanoparticles. And I'll try and see if I can help you to get through the science because the science is quite complex. So, what did I start with? I started here with this paper, and this is from Bench to Bedside: The Implications of Lipid Nanoparticle Carrier Reactogenicity for Advancing Nucleic Acid Therapeutics. Quite a big thing. This was in July 2023. So, this was after the rollout of the vaccine. And so they were just looking at the actual technology, the nanomaterial based delivery vehicles, such as lipid nanoparticles. What you have to realize is we've never really done this, certainly not at scale before. And there's some important questions about how it reacts of empty lipid nanoparticles. Now, the reason that that's important is that it's a simple question, is that if there is a problem after somebody, say, has been vaccinated, is the problem due to the mRNA producing spike protein or to the immune system reacting just to the lipid nanoparticles? So the first thing I realize is that they've never checked. Nobody knows until this study technically came out. So they were doing this without even knowing that question. What happens if you just inject lipid nanoparticle, nothing in it? What impact does it have on the immune system? So, in preparation for what Christy Grace spoke about, I thought it was important for you to understand just really what it looks like with regards to what they're trying to achieve with these lipid nanoparticles. So, from the same paper, I've got this lovely image. So, what you have here is on the inside here is where the mRNA nucleotide strands are. And so these are much bigger than what they had been working with before. So they had to kind of come up with a new structure. So inside this ball, it's almost looking like a virus. They have in here they have these cholesterol molecules here. They've got the PEG lipids. And if you notice, the PEG has this tail on it as well. So, and I'll show you what that looks like in a second. Then you have all of the other pieces put there. And I'll actually show you in a, let me just bring this up so that you can see it. There is a breakdown as to exactly what is in these specific lipid nanoparticles, and it's slightly different depending on what company was involved. And so you have here, they have an ionizable lipid, okay? And this one here is from an onpatrotherapy. The ionizable lipid is slightly different with Moderna. It's SM102, and you can see that this is slightly different from this one here. So that ionizable lipid is different in the Pfizer one. So a slight difference between the Pfizer and the Moderna one, but the mRNA I think is the same in both of the vaccines. But the actual lipid nanoparticle has some differences. There's a helper lipid as well. That seems to be the same. Then they have the stabilizing cholesterol here. And then they have the shielding component, which is the PEG. And that's the bit that has the tail. And what I'll do is I'll show you in a second what that tail looks like. There's an interesting article that demonstrates it here, and I think I can show you here as well. So this is what the PEG part looks like, and then you have this lipid tail. And so this helps to make the lipid nanoparticle not be picked up by the immune system. So it's an important part of the process. And it's possible that this part can trigger immune responses as well. So now that you have all of that, we can then go back to that image that we had here. And you can see, again, the PEG, this brownish thing with the tail. This is a lipid tail with the PEG there. There's cholesterol. There's the ionizable lipids. And all of this together makes up one lipid nanoparticle, which will have multiple copies of mRNA in it. Then this is injected, multiple thousands of them, I guess. They get picked up by cells, and then it's released into the cytoplasm to start making mRNA. The concern with Christy Grace was just around these lipid nanoparticles themselves on their own, forgetting about the fact that they have mRNA in them that makes toxic spike protein. This lipid nanoparticle on its own could be a problem. And that's really what she was saying in the conference. And so what I want to do is I want to quickly add this presentation, and I may jump in because some of the stuff she talks about is so complex and she's going so fast that I may pause it and show you some of the images to try and see if I can help it to make a little bit of sense. So let's run through that. And my job here is to try my best to simplify some of these concepts for you.
I'm in the United States. I'm 48. I have 5 majors, actually, including my MSc, and I've been a process and project manager for the largest plasmid company in the world, Aldevron, and then I branched off to do my own consultant work. I've been managing from startups to big pharmaceuticals, recently changed careers, but my specific background is with recombinant proteins, such as spike protein, and then something similar, but LNP and RNA and project development for custom, anything you could think of for biologics. So I'm here to present today on the adverse events and a lot of things that have been overlooked by large media accounts, large accounts on Twitter, and people posting who have been ignoring this data. Thank you so much. I'm going to zip through the slides. I've got over 70 slides. I'm just going to give summaries, and then these are available for download. This is on the lipid nanoparticle concerns, charges, mutations, plasmids, and adverse events. And thanks again, you mentioned Kevin McKernan and Philip Buchholz for doing the work that they're doing and working with the plasmids. We're just going to go over briefly what the construction of a lipid nanoparticle looks like with mRNA. You've got the various lipids. There's positively charged lipids. There are PEG, TSPC. We're going to be focusing on the charged particles. The RNA has a negative charge in the center, and that's surrounded by positively charged lipids by electrostatic interactions. And some things have been happening that a lot of people haven't been talking about. There's confirmed studies that the positively charged lipids are causing clots. There's also confirmed studies that if there's an overabundance of these lipids that are positively charged, they'll go right to the lungs and cause adverse events, including clots. So the positively charged lipids, there was a recent study that no one has talked about where they used special analysis and they looked at the lipid nanoparticle with the current injections that are happening across the globe, where the positively charged lipids are mutating the RNA inside that lipid nanoparticle. And this is extraordinarily detrimental. And the one thing that they did not talk about is the exact mechanism and the implications that it would have on the human body, because the mechanism is the same. Human bodies have RNA in it, human bodies have DNA in it. These are called nucleic acids. If the positively charged lipids are mutating the RNA within the lipid nanoparticle, then they absolutely are mutating RNA and DNA within the human body. Then you can ask how that would occur and how it would get into the DNA. We're going to start with the RNA. The RNA mutations are happening because 70% of the RNA that are in the cells of our bodies are outside of the nucleus. So if it's interacting with that, it's going to cause mutations. You're looking at aggregation. There's amyloidosis, all of the things that Joachim Gerlach spoke about earlier. You'd be looking at loss of translation, aggregation, amyloid, misfold, neurodegenerative disease, cancer, you name it, sickle cell disease. The possibilities are endless. Just pull from a big buffet of issues. Then you could ask yourself, why would DNA be mutated? How would they get into the center of the nucleus? The way that they would get into the center of the nucleus is if you had plasmids within the lipid nanoparticle that didn't belong, that are DNA plasmids. The positively charged lipids are connected to those, and they'd hitch a ride into the nucleus and thereby would be mutating the DNA of those cells. So again, this study was proven. They used analysis.
I'll just pause there just temporarily. I mean, that's a lot of information she's already covered there, looking at characteristics about the lipid nanoparticles changing the mRNA, and so therefore mutating it, and therefore increasing the risk of lots of either neurodegenerative diseases or even things like cancer. Serious, quite significant um, concerns, and you'll learn by the end, when she goes to the end, that this has been quite a threat to her to be talking about these things. This was over a year ago, and but the relevance of it is still very important for us to grasp. So again, I'm just breaking it so that you don't get lost, because she's going through a lot of slides. And if you want the slides, the link in the description will take you to the full presentation, and there are multiple presenters that were there, and you will be able to download the PDF of this presentation if you wanted to look at it in some more details. Let's continue and see what else she has to say.
Hypothesis. With that, you'd be looking at cancer. You'd be looking at dysregulation of more than just P53. A lot of people are talking about P53. There's tons of dead box proteins involved with these kinds of mutations. Recently, on Dr. Drew and Dr. Kelly Victory, much love to Dr. Victory. I know she's suffering right now from cancer, and our thoughts are with her. Dr. Thorpe and his work with OBGYN. Now, he talked about stillbirths, and he was talking about the RNA, but the thing is, both the plasmids that are present and the lipid that are positively charged can impact these dead box, what are called dead box proteins. And these would actually be the adverse events that you would see in babies, in children, and it would be involving these dead box proteins that are representative here. And the reason why is if a pregnant mother is injected with a substance, the baby's blood-brain barrier isn't developed yet. It's just coming and going. There's no barrier to stop anything from coming and going. So those positively charged and negatively charged lipids are just flowing in and out of there. And again, there's just so many host of issues that are happening. There's also what's called ion bridging that's involved. I know we went through this really fast. Then there are negative charges within these lipid nanoparticles. And the reason there are negative charges is because the RNA and the plasmids that are contaminating them are highly electronegative. A study that was done in 2019 that was published in the beginning of 2020 looked at the adverse effect of negatively charged lipids on the human body. And what they found are these spindle clots, the same exact spindle clots that embalmers have been reporting on, that people have been stating don't exist. It's right in the study. All the references are here. So this would be the cause of these big thick clots that people are finding. And again, that's the negative charge that is impacting the lipid. So again, we're going to talk really quickly about net charge, zeta potential.
Just pausing there again, because she mentioned something that has been right at the focus with regards to the embalmer's clots. and the fact that these lipid nanoparticles could be a contributing factor for them. Now, when I recently did a presentation on this and I looked at it, I think that I was looking at the fact that it is an immune response that occurs relatively suddenly that seems to cause all of this accumulation. However, the fact that these lipid nanoparticles could get stuck in them, because what I was trying to work out, and I'm going to be coming to this in another presentation when we talk about the self-assembling mRNA, where they continue to produce. The question is that these lipid nanoparticles are not a normal part of the body. So I guess the cholesterol can be taken up, but the PEG, the critical part of it, what happens to this? How is it degraded? How does the body get rid of it? Is it able to be passed out in urine? Does it get passed out in bile? What happens if it accumulates? Does it represent the adjuvant for the mRNA vaccines where it stays in the body and just continues to drive immune responses? These are all very, very important questions that I don't think there are full answers to. So, whenever you speak to someone about this, you just remind them that we are still in the learning phase. And that's one of the reasons why I made the stand that if you are giving anything for COVID, focus on your high risk where you know that there could be benefit. Why would you take the risk when you don't know the longer term implications for many of the things? This is a new technology. It has not been old. It's only been tested at this kind of scale for the first time. So we are just learning about the implications. And over the next 5 to 10 years, we will see whether or not it actually is as safe as it has been purported to be. But let's continue to listen to what Christy has to say.
Particle and how this would change. There's my little drawing of the RNA in the center that's negatively charged, and then you have the positive charges surrounding that. And there have been studies recently done regarding the lipid nanoparticle. In order for the lipid nanoparticle to not have adverse events, it would have to have this neutral charge to it. Some studies were done recently, and there's a webinar on YouTube and a link here where doctors and scientists decided to alter ratios of positive and negative charges within the lipid nanoparticle to see where it goes. This slide is important. This is directly from Pfizer. Pfizer states that their lipid nanoparticle for the current injections is supposed to have a neutral to slightly negative charge. They measured the what's called zeta potential, which is the surface charge of the LNP at minus 3 millivolts. If it were something different, it could lead to binding events in the blood compartment, aka clots. Now, what would happen if you had a nanoparticle that had a charge on it other than what it was supposed to? These are the original biodistribution data slides that were leaked out of Japan. So again, researchers, they looked at manipulating the charges, and they decided, what if we pull out some of the RNA and we had a higher amount of positive charges? If we pulled out the positive charges and we had a higher amount of negatively charged RNA, hence a more positively charged particle, it's going to the lungs. If we have a more negative charged particle, it's going to the spleen. And if it's slightly more negative, then it's leaking right into the vascular. And it doesn't even matter if you inject it into the muscle and if you aspirate. Because of the highly negative charge, it's going to bind to platelets, which are positively charged. And that means clotting. And again, we look back to this Pfizer data. That's an internal document that was.
I'm going to pause that there. There is a very important thing that she said that it would be very difficult for you to see. So I'm just going to quickly add it here so that what she was talking about was that if the lipid nanoparticles charge, remember before this, let me see if I can roll it back. So the charge that they needed was minus 3.13 millivolts. That's that bit there. So the question they ask is what happens if you use a different charge? If, for instance, some of the negative charge inside the lipid nanoparticle is less, so therefore you have less of a charge. And so that's the bit that she was talking about here. So depending on the charge would determine that it could go to the lungs, to the spleen, to the liver. And this is what they found when, if it was injected with a slightly different charge and it then circulates, it goes to different organs in the body. And that can explain why some of the patterns with regards to complications can be so varied. Really, really worrying and fascinating stuff that we really have to reflect on. So let's continue with what she has to say and continue with this educational worrying information.
They admit that if it's not neutral or very slightly negative, you're going to have clots. So the way that things are happening and why adverse events are happening is because one of the issues is the lipid nanoparticles breaking down during the freeze-thaw process. There are more studies. There's 3 or 4 at least that I've included here where they looked at imaging of the nanoparticle breaking down. So then an RNA might slip out. An RNA is highly electronegative. This means the cell would now be more positively charged. The lipid nanoparticle would be more positively charged. It would go to the lung. It would cause a clot. If the RNA, which is negative, would leak out, again, positive charge. If the positive charge lipids would leak out, then you'd have a negatively charged thing that would go to the vascular, go to the blood vessels, go to the brain, go to the heart. This is a famous study by Dr. Ko that was just done. He is extensive LNP expert out of Korea. I think he's published about 80 papers. He took a look at the LNPs also breaking down. Also, the lipids are going through aggregation. Oswald effect, a little smaller lipid attaches to a bigger one, it grows. You have, by charge, you have what's called flocculation, ion bridging, what we need to talk about as well. But again, these would cause the aneurysms because there's a certain size that biologics can only be. And when the lipids clump together, then you'd have something like this going on. And this would be the thing that's responsible. Another important thing about these contamination is, again, thank you, Kevin McKernan and Philip Bulk-Holtz for plasmid discovery and the lipid nanoparticle. So when the lipid nanoparticle is formed, you've got lipids involved in RNA. But if these plasmids are in there, the plasmids are getting sucked into the lipid nanoparticle, and then that's going to cause adverse events. So what you have to do is try to calculate what the new zeta potential is going to be in that lipid nanoparticle. So I took all the base pairs of the sequence that Kevin McKernan listed on his Substack. Thank you very much. I took a total of that. So the charge on the one plasmid is now a negative 256. And if we plug that into this equation, which would give you the millivolt of the new lipid nanoparticle, you're looking at the minus 40 range. So you're looking at with just one plasmid would get sucked up in the lipid nanoparticle. You'd have what's called DNA, RNA polylipoplex. And you would have a highly negatively charged particle, which would leak right into the vascular and cause.
I'm just pausing there for a second. There's something she mentioned with regards to the plasmid and the contaminants. Just in case you're not aware, one of the factors that had been picked up, I think it was by Kevin McKernan, is that when they analyzed the vials, they found that it was contaminated with a number of other things that shouldn't be in there. Plasmids were one, SV40, simian virus 40 was another. There are a number of things that shouldn't have been there. And this was raised, I think, in terms of being put in front of Health Canada at the time. And Health Canada is probably the only place, as I can find in the world, where they have actually pulled the vaccines completely. And they're going to be bringing new updated vaccines in October. So they are no longer, it's almost illegal to deliver it. I wondered whether or not the information about the contaminants were a factor. We don't know. But it would explain why they pulled them completely. They would probably then clear the contaminants and therefore bring a new batch, fresh batch in October to then deliver new updated vaccines as well. But that issue of contaminants is a really important topic on its own, and one that I'll see if I can ever find Kevin McKernan. But it is again very, very complex. But hopefully we can get the stuff broken down. Let's continue with what she had to say.
And misfolding, aggregation. There's so many bad things that are occurring here. Here's what would happen is if a piece of the plasmid was surrounded by positively charged cationic lipids, which is almost positively happening, it would get sucked into the nucleus, and then you would have plasmid hitting the DNA, the SV40 promoter that's on that plasmid, but also you have positively charged cationic lipids entering the nucleus if this is indeed occurring, and then that would mutate DNA and cause catastrophic effects. Also, another thing that's happening, which someone I think is presenting here today, and also Dr. Hazen, is that the destruction of the gut microbiome. There was a study done that is mentioned here that is outside of the current researchers presenting, where they took E. coli and they overexpressed protein in E. coli, and the E. coli killed themselves in order to think that they were saving themselves from an evolutionary standpoint. So if plasmids entered the bacteria of the body, and this is very important because bacteria exists in harmony with human cells, at least 1-to-1 ratio, used to be known 3-to-1 ratio, but 1-to-1 bacterial cells to human cells in the body. It is more important than I think that some people are giving attention to, that the bacteria of our bodies would be altered if those plasmids would hit, and it would be integrated into the bacteria as well.
Pause that there. Again, you may miss that. That is probably one of the most serious implications because I think it was Dr. Hazan who I'd spoken to as well, who did some very interesting research and found that after vaccination, one specific bacterial genus, the bifidobacteria, were almost completely wiped out. Now, a similar pattern occurs after infection as well. So it suggests that there is something about the RNA or the spike protein that is impacting these bacteria in different ways. But what I think we're getting here is that the lipid nanoparticle with plasmid getting into bacteria could also contribute to some of these very unusual patterns. These cause diseases in the long term, and this is one of the big issues as to why we need to keep focused on it, is because if 5 years down the line we're seeing strange problems, what then happens is nobody remembers what occurred around this time, and therefore it gets completely missed in terms of trying to make a link. And the link is not just about trying to blame anybody, it's just that if you don't understand what happened, it makes it more difficult to mitigate the damage. But let's go on to listen to what else she had to say.
So you have also got, via the plasmid, you'd have old viruses, latent viruses would be reactivating due to interactions with what is called intracondensates within the cells, and these studies have been done. And then in layman's terms, if you had a DNA plasmid entering a cell, it's going to drive cell expression. It's going to make it go incredibly fast or slow it down in ways that you couldn't even think of. Turbo cancer, that's a phrase that's been getting tossed around. You would have, again, dead box proteins would be enhanced, or they'd be misregulated. Different locations in the body. It's just scary and a nightmare of what would happen if those plasmids are in there. Plasmids in the brain. It's known that plasmids in the brain have been studied accidentally would cause microglia scarring. It would cause neurodegenerative disease, ALS, Alzheimer's. Also, for human health overall, and the plasmids, there's something called the SV40 promoter, is something that drives gene expression. The proteomics of the liver makes millions of proteins every day. It is responsible for 170 different interactions in the entire human body. So it's not just focalized into the liver. It's responsible, and doctors might be able to chime in after I speak on this or for a Q&A, that the liver is responsible for 170 different processes across the human body. So if you have some plasmids or positively charged lipids that are mutating anything within the liver, you have the potential for impacting the entire human body. Then you've got, so I guess the layman's terms is for the SV40 promoter. There's some laid out here if you'd like to read on that and not get so sciencey for people who don't have degrees. I've laid everything out because I've also been a tutor of science and worked with teenagers for about 30 years and explaining science in a way where people can understand. Like if you had a conductor of an orchestra and someone took the sheet music and altered it in some way, you're going to alter the entire course of what that music is playing, except you just did it to the human body. Or if you changed a stoplight, or you changed a recipe and you were making cookies and you substituted out some of the ingredients and you now made a toxic cookie, and then it would impact things for an incredible amount of time. So I guess for the summary, cationic lipids within the lipid nanoparticle, which are positively charged, are known via multiple studies to cause clots, adverse events, and reactions with the immune system. A recent study was done that the positively charged lipids that surround the RNA that are bound by electrostatic interactions are known and were shown via reverse HPLC with ion analysis to mutate the RNA within the lipid nanoparticle. And again, the one thing that these researchers in the study did not point out, which was very obvious, is if these positively charged lipid nanoparticles are mutating the RNA, causing it to aggregate, causing it to misfold when the spike protein already misfolds within the lipid nanoparticle, and if they came in contact with human RNA or human DNA or even human proteins in any way, whether that be motor proteins, transport proteins, any kind of RNA in the cell that is helicase, doesn't matter. It's going to mutate it and cause a point mutation, cancer, ALS, sickle cell anemia, Johns Hopkins disease, multiple sclerosis, neurodegenerative disease. If this is given to a woman who is pregnant and it lands in the womb into that baby, in the fetus, you would see cleft palate, stillbirths, all the things that Dr. Thorpe has been raising the alarm on. It's just a scary nightmare. There's some ancillary things that I've got here. I've got active FOIAs right now because I've worked in the industry for, again, a few years now. And I've very recently this year, changed careers, but I am well aware of some contamination issues that have occurred because I have sources still within the industry. So there, I just admitted it. And I've got FOIAs active where the FDA is refusing to respond to me right now. I've been demanding contamination concerns at the sites for Moderna, Catalent, and Pfizer in the United States for 2023, especially the Bloomington, Indiana site, to demand the FDA turn over all contamination records that may have occurred, especially if they had recent steel shavings in June of 2023 and fired their director. I want the FDA to admit that's happening. Again, these slides are there for everybody to view. I just wanted to thank everyone so much. I know I went over things very quickly. Again, here's some slides on the liver proteome and everything that would be happening in the human body. And here is something that is the Moderna patent that isn't really available to the public, that speaks to RNA with LNP expressing over years. I want to thank everyone that's going to be in this presentation. I look forward to future Q&A. Thank you so much, Philip and Joachim, everyone that's about to go today. Kevin McKernan, especially for all the work that he's done. Philip Buchholz for currently doing his work. And thank you for the group holding this conference that's been aware of the detrimental effects and everything that they're doing right now to look for promising solutions to everything we're dealing with. Thank you.
Wonderful.
At
Thank you
this
very
time here, I'll
much,
just
Di.
pause before we go into the Q&A. I think this is the time where you say something like, "You rock, girl." She's so good. But it was true, is that she did have to go through the slides very quickly because it was a tight time limit with the presentation. I'd love to get her again so that she has time. It would be a very complex discussion, but it would be one where one would be able to interrupt her to help to make her explain a little bit more about some of the science around it. Before we finished, well, I'm going to play the question and answer bit. That's still a little bit longer that we have for question and answer when we did it then. But just to remind people, because some people would have just come in, this is what we're talking about, the fact that the lipid nanoparticle. So, just a reminder that inside the lipid nanoparticle is the mRNA. But this shell that that carries it into the cell, is composed of cholesterol, ionizable lipids, and these pegylated materials with the tail. And this is what helps the lipid nanoparticle to evade the immune system so it doesn't get picked up until it goes inside cells. So the question really is, what happens to this carrier molecule? And somebody had asked a question in the presentation about, does this happen in the body? Now, it is really actually a replication of the endosomal system in the body, where what happens is that cells need to transfer information to other cells. And so they make these little packages almost where they put various things in it, including RNA or molecules, proteins. And the similar thing happens with cells that are struggling to manage protein. So, like in diseases like Alzheimer's, where you have amyloid accumulation, they may package it and pass it on to other cells to help them degrade it. This is why you see a spreading of the abnormal protein. So it's like piggybacking on a normal system, but it's using slightly different products, which means that we don't fully understand the longer term implications and how the body gets rid of it. let's listen to the question and answer section that we had there. And remember, in the description is a link to the full conference as well as all the presenter slides. So even though this was last year, this is valuable information if you wanted to do more research, because all the references that she spoke to are in that big presentation slide. So let's do the question and answer and hear a few more thoughts before we close up.
That is some heavyweight stuff. All right. So why don't we start? Joachim, do you want to start with some of this first? What was your first question?
I have so many, but okay, we don't have so much time right now, so I don't want to hold up the whole conference, but thank you so much, Christy, for coming out and explaining that. What an incredible job you have done there, and great courage to come out in the public with this, because there are now some questions. Okay, the first one would be, have these mutations already been documented by sequencing genome before and after COVID or vaccination? Or should we go about and do that?
Thanks for asking that. Thanks so much again. I know that Philip Buchholz, Dr. Philip Buchholz, who's in either Carolina, North or Southern Carolina, who's a genomics professor, we've been in contact with. I know currently he has requested tissue, exactly what you're asking for, including testing stem cells to see if genomic integration did occur with the plasmids. He's also aware of the risks. With that being said, I'm not suicidal. Philip Buchholz has also messaged me saying he's not suicidal, and that if he ends up harmed anywhere, that was not intentional, and someone nefarious intent probably occurred. So I think that's probably the case with all of us. We're all in sane mental health and happy and good, and we have no intention of harming ourselves or others. But yes, Philip Buchholz is currently testing for plasmid integration, and he's looking at the stem cells especially. But I don't know, and I can't speak to if any has occurred previously or if anyone has that information.
But you're speaking about a permanent DNA integration of sequences of what? Is it because is it then transporting sequences of SARS-CoV-2 or spike into our genome, or other things? What is happening there?
Thanks for asking. The RNA, I like to think of as a blueprint. If you had a 3D printer and you gave it instructions to print whatever you wanted, and in this case, it would be the spike protein, and the RNA would go into that 3D printer and print out the spike protein. And when I talked about mutations of the RNA, that isn't permanent. That's not getting spread across generations, but it can misfold, cause the ALS, the neurodegenerative stuff that we're talking about today, cancers and more, because there are studies that show that non-coding or non-working proteins absolutely are oncogenic far before 2019. There are just years of studies on that. But with the plasmids, those are DNA. So when we speak to science, there's a central dogma of biology that a lot of us refer to as DNA to RNA to a protein. And the plasmids that were used by Pfizer were not entirely reported to the FDA, which Kevin McKernan has also commented on, and others. DNA, if it makes it into the nucleus, that plasmid was the plasmid that made the RNA, and it appears that it wasn't filtered out properly. So it's actual DNA that could possibly either change the way a gene is behaving. So even if it didn't integrate, it could change the way something is behaving with regards to all of our cellular processes, all of them.
Do you
all
mind
of
if
that's just a crapshoot where it would land.
Yeah. Let me ask you a question, Christy. So the industry may say, well, in reality, even if this occurs, it could occur only in a small fraction of vaccinations, and it therefore may not necessarily be too relevant clinically. What would you say to that?
Joanna Krieger in Germany in 2021 gave a committee presentation who has far more like molecular in the human level, because I've done the process managing and the design of all this stuff, where I think the medical people are probably, I don't want to like kick the ball down the field, but I can remember her speaking in Germany at a committee for 2021 saying that when we talk about the current adverse events that we're seeing now, she talked to, even if it just landed in a couple of cells and it only changed a couple of cells, if these cells are replicating, like the most cells that replicate, and someone can correct me, are in the gut, in the GI tract compared to the rest of the body, those would replicate faster if you had a mutation. But in other areas, you might not see this carry over in the daughter cells until 3 to 5 years, possibly longer. So we just don't know. The body might have taken care of it. So I think it's just a combination. I think Kevin McKern's also said, like, where it landed, when it landed, did the body take care of it? Was it with someone who already had a pre-existing mutation? So I have some of the slides like BRCA gene and there's multiple, the CRAS gene. Like if someone already had a mutation present, but they weren't exhibiting symptoms and it wasn't something they would have ever developed, or like if somebody had Hashimoto's or an existing immune system disorder, it could just drive something to be worse. So I think that's a complicated question. And I think alongside others, there's consequences we haven't seen yet.
Wow.
Scary enough. I hope I'm wrong. Please prove people wrong, or someone proves that it's not. Yeah, I'm worried.
I'm just going to take a quick question here, Josh, and before I let you ask your question here. Somebody pointed this out, and I think it's worthwhile. What about the adenovirus vaccines? Now, they use a completely different platform.
Yeah.
Mhm.
Thanks for asking, Susan. Thank you so much. I used to have a Substack and I deleted and I kind of wrote on that the adenovirus vaccines were experiencing clots because there's a negatively charged backbone, if that makes sense. It has if we think of minus and plus charges being attracted to one another. I know that the study that showed the adverse events from the adenovirus vaccine, because it has a negative charge in the virus, it is attracted to things that have a positive charge. And there are people that have mutations, call it platelet factor 4, so PF4, platelet factor 4. They have mutations in this expression of this, and the people that got the clots had more positively charged things going on in their body with the platelet factor 4. So the negatively charged adenovirus bound to the platelet factor 4 and then caused clots. So that's what was happening with those, but they weren't RNA based. So I don't want to say that they're safer. They have their own host of issues. I would assume they would be less compared to everything we're seeing, especially with now that study that I presented today on the positively charged lipids that can still mutate RNA and DNA and have nothing to do with a plasmid.
Excellent. I'll let Joachim ask the final question, and then we'll shift to our next speaker, who is Charles.
Yes, of course, we have I'm always looking at this from the angle of what can be done to mitigate these processes. So if it really integrates is a permanent integration into the DNA, then that would be very difficult to treat in any kind of conventional interventions. But to come to the point, the thrombi formation that you were explaining, that is something that is within this group, especially with Dr. Jäger and other practitioners and medics, a big topic. So it would be very good if we could understand better how the thrombi formation is being caused. But these lipid nanoparticles are only there once you have been vaccinated recently. After a while, they will disperse and also kind of dissolve, isn't it?
It would depend. That depends on a lot of things. The LNP, the lipid nanoparticle, vary in size from 50 to 200 is at nanomillimeter. And if they were going to exit through the kidneys, the glomerular pore, again, please someone correct me, is smaller than the smallest size of the lipid nanoparticle. So there's no way they could be expelled via urine, especially if they have aggregated or clumped together, that they wouldn't be exiting that way, and they wouldn't be exiting via pore. They wouldn't, like you would have to, sorry, TMI, like defecate. As far as the charges don't go away. So when we talk about a positively charged or negatively charged thing, those just don't go away. And I know that you and I have spoken before about things just kind of docking in, because they're not just going to be free floating forever. They're just gonna stick somewhere. The body, I think, does have ways to deal with them, but then it's just a toss-up, depending on where they landed, how much someone got, if someone got the plasmids or not.
Yeah, so this is, as I said, the clip from a really important clip. I'd love to get her again to discuss her thoughts now. But it raises the point that we are still in the investigation phase, the understanding phase about the technology. This is why I've always maintained, and I will always say the same thing over and over. When we started the program, it should have only been for the high risk, because that's where the risk benefit ratio made sense. If you're using a new technology, why would you use it on your low risk cohorts? It really made no sense. So even now, the fact that this is going against the recommendation from some of the major health platforms or organizations in the world, but giving it to 6 month olds, really? Luckily, depending on where you are in the world, different countries are now starting to align with the science. So, what you have to look at is which countries are doing that, which countries aren't. The ones that aren't, let them explain why they aren't doing that either, as opposed to who is doing it. And so these are pretty important questions, and there is still a lot to be learned. We don't fully understand the longer term implications, and on a separate time I will deal with the self-replicating mRNA platform that is coming. It's remarkable, we haven't even fully understood the mRNA platform, and they're expanding it to use different techniques that we still don't understand. So that raises even more questions down the line, but that will be dealt with separately. Main point here is that this full presentation is available at the link below. It's like a 3 hour, 3.5 hour conference with question and answers. So it was from last year, but the information is still very valid today. And most critically, all of the presenters were willing to share their slides, so you can get the PDF slides. Before we leave, just again a reminder about in another few days, I'll be having session 3, where we take questions before and we discuss some of the questions and the concerns about your health, just to help you to get a better understanding of what is happening. And don't forget to support or drive for being prepared for what we call disease X. But truthfully, everything that I have seen here is that this is likely to be just another version of COVID. It hasn't gone away, even though some people want it to. So thank you for being with me here now, and we look forward to bringing you more science, more information, challenging topics. That's what we're here to do. We're not here to follow a narrative. We'll ask all the hard questions. So remember, like and subscribe. And if you're interested, join the membership, where I share little short bursts of information that hopefully it'll be of value to you. Have a great evening.